Coming of Age is coming up next. I'm your host, Emily Echeverria. First today, we're talking with cardiothoracic surgeon Dr. Russell Ronson about the innovative care offered at the Baptist Heart Vascular Institute. Next up, if you haven't started planning and preparing for hurricane season, it's time to start. We've got Escambia County Emergency Management here to talk to us about how to keep yourself and your loved ones safe in case of a storm. Lastly, we're speaking to the executive director of OASIS Florida, a nonprofit working to prevent the spread of HIV and to support those who are affected by HIV and AIDS. Stay with us. Coming of Age starts right now. As we age, staying active in life and involved in the community can become a challenge. But with Council on Aging of West Florida's wide range of home-based services, you remain healthy, independent, and engaged. From Meals on Wheels and respite care to senior dining sites and the retreat, you'll find the support and connection that you need to age well. Aging looks different for everyone, and we're here to help you meet your needs and thrive while maintaining what makes you, you. We've been in the community since 1972, advocating for elders and supporting those who care for our parents and grandparents. Now, join us as we discuss the age-related issues that matter to you. Baptist Heart Vascular Institute provides groundbreaking heart care with the largest and most experienced team of cardiovascular specialists in Northwest Florida. Collectively, the group has pioneered virtually every new innovation in heart care in our region and continuously earns awards for quality and excellence. Here today to discuss what the Heart Vascular Institute has to offer to our community is Russell Ronson, a cardiothoracic surgeon at Baptist. Thank you for joining us today.
Thanks for having me.
Tell us a little about yourself and what brought you to Pensacola.
So I started my training out of Texas, moved to Dartmouth College for medical school. From there, went to Emory for my general surgery, and then University of Virginia for my cardiac, thoracic, and vascular. Following that, in 2002, went to Birmingham, where I was faculty at UAB and in private practice for almost 19 years prior to coming here about 2 years ago. Saw an opportunity in the Heart and Vascular Institute here and a community that was committed and in need of advanced cardiovascular services, and here I am.
So tell us, what is the Heart and Vascular Institute and why is it so important?
So the Heart and Vascular Institute was created to have a comprehensive cardiovascular service line. All aspects of heart and vascular services. We have 4 primary pillars within that institute. We have what we call our non-invasive cardiology sector that are experts in hypertension, cholesterol management, continuing cardiac care imaging with ultrasounds or advanced x-rays such as cardiac CT or MRI. Then you have a pillar of invasive cardiology that are experts at stenting and diagnosis internally of blood vessel disease, pairing with the surgeons that are the third pillar to do complex advanced techniques that require both skill sets of putting in minimally invasive heart valves or putting in stents in aneurysms. And finally, the fourth pillar is our electrophysiology pillar that deals with all of the electrical system of the heart, whether it be pacemakers, defibrillators, ablations for abnormal heart rhythms. But what a Heart and Vascular Institute allows us to do is to take care of everything with everybody in their area of expertise, all swimming in the same direction, helping each other and giving the patient the best possible care by the best possible person.
Okay. What services are available in cardiac and vascular surgery at Baptist Hospital, and what are some of the newer services?
So we provide everything, just short of heart transplant, where really you would have to go to a transplant center, but everything else that is heart and vascular, we provide. Everything from minimally invasive surgeries to where we put in valves, which is some of the newest things that we do, clips on a mitral valve or an aortic valve called a TAVR that you can see or read about in lots of social media and media posts. All of the endovascular treatments, meaning inside the blood vessel without making incisions, for treating aneurysms or blocked blood vessels that used to require a fairly large surgery, now can be done minimally invasively. But what we have done, and part of the reason that I chose to join this this venture of the Heart and Vascular Institute and cardiovascular care here, is we've tried to make all of the best care locally. Tried to make it so that you didn't have to go to a Tallahassee or an Atlanta or Birmingham. You have all of that expertise and all of that technology here.
Gotcha. And what about thoracic or lung surgery?
So the other part of my practice is thoracic surgery, primarily composing of lung cancer disease or infections of the lung that require either surgery or biopsy. And again, we've sort of specialized and tailored this with our cancer or oncology folks and our lung cancer screening, which is the largest in the region, where we can pick things up earlier, treat lung cancers earlier, and do that with either minimally invasive techniques or radiotherapy and really the most cutting edge technology that you would see just about anywhere.
And how do patients get to the Heart and Vascular Institute, and more specifically to you?
So there's multiple ways that can happen. Most commonly, either a patient directly refers themselves, they've heard our name, they've heard our services, they know the reputation that the Baptist Hospital and Baptist Heart and Vascular Institute has, and they simply call and make an appointment. The other way is primary care physicians will refer based on the problem to the specialist of their choice, whether it be an electrophysiologist for electrical problems, a surgeon, or for a vascular problem or a valve problem, or to one of our cardiologists for ongoing maintenance of congestive heart failure or hypertension. But we encourage both patients and providers to give us a call, and we're happy to say, yes, that's something that we really think we should take care of, or here may be a way to help take care of this at home or in your own practice.
If you could give one message to the public, what would it be?
I think the most important thing about the Heart and Vascular Institute is we take care of each patient at the highest level. That the need for going to bigger centers or bigger cities, because you might find something that really is not the case anymore. That the investment that we've had in our own physicians and in our program and in the Heart and Vascular Institute and with the new campus out at Brett Lane, that you are going to get the highest level of care in this region without having to travel hours, and the challenges of that with return appointments or interventions or follow-ups, that we can do that all right here with a lot of thought and a lot of expertise.
Wonderful. Thank you again for being here.
Thanks for having me.
Next up, we're speaking with Escambia County Emergency Management about what you need to know to prepare for this year's hurricane season.
If you're looking for a fun and exciting environment for your loved one, then L&L Executive Adult Daycare is a perfect fit. We offer social gatherings, physical activities, games, outings, and daily luncheons from Karen's Catering. We take a holistic approach to social stimulation and aim to enrich the lives of our guests. Let us help restore your loved one's mind, body, and soul. We'd love to speak to you. L&L Executive Adult Daycare. Big business love with small town feel.
The Reesburg Institute, Pensacola's ear, nose, throat, and voice center. We welcome you to visit us at our convenient Davis Highway location in Pensacola. At the Reesburg Institute, we offer the most advanced treatment available in a calm, stress-free environment. Since 2014, we've performed over 1,000 cases in office of balloon sinus surgery, as well as septoplasty and nasal procedures using oral sedation. The in-office procedures result in a faster healing time. Visit us and feel the difference. The Beacon at Gulf Breeze offers the finest senior living community in the area. We are here for your loved ones who need assisted living and advanced memory care services. seniors will feel right at home with studio, one-bedroom apartments, a large dining area, a beautiful landscape courtyard, and even a salon. With professional staff and one-on-one care, your loved ones are our top priority. Welcome to the Beacon at Gulf Breeze. Welcome home.
The 2022 hurricane season is underway, and as storm activity ramps up in the Atlantic, everyone in our community needs to prepare for the possibility of a destructive storm. Seniors and caregivers may have specific concerns in the event of a storm, so we're talking to Travis Tompkins with Escambia County Emergency Management about what you can do to be prepared and stay safe this season. Thank you for joining us today.
Thank you for having me.
So tell us about the Escambia County Emergency Management and your role.
Well, Escambia County Emergency Management, we're the coordinating agency for the entire county for preparedness, recovery, and response to any disaster, not just hurricanes. And so we're a coordinating agency where we bring in all of our partners into the Emergency Operations Center during a disaster, and we all work together to work through any situation that's affecting our county.
And what are some steps elder adults can take to prepare their homes for the season?
So first and foremost, needing to know whether or not you're in an evacuation zone. That's the key component first to know if you're in a zone from A to E. So A being one of our smaller storms to E being like a Category 5 storm. So what we would ask everyone to do is to go to beready@escambia.com or myescambia.com/beready. You can Google that as well. There's a know your zone part on that. All you have to do is put your address in and it'll tell you what zone that you're in, if you're even in a zone. And those are, if you're living on the beach or if you're living in a low-lying area, it'll tell you that, and that will indicate that you're in an evacuation zone and you would need to evacuate. Now, what we always say is that you run from the water and you hide from the wind. And so storm surge is what we're worried about with those evacuation zones. If you're staying in your home, you want to make sure that you have shutters, that you have, if you don't have shutters put in, that you at least have plywood put in place, and that you have somebody that can help you put those up. For our older adults, it's really important that they make sure that they are in contact with other people that might be able to assist them with that.
Sure. And how about things they can do to be ready physically and medically?
So very much make sure that you have got refills for your medication. That's very, very important. Some folks are on oxygen or they have other needs that they have, medical needs that they have. They want to make sure that they have a backup resource for that. It's so important to make sure that your scripts are filled. I mean, it could be weeks before the pharmacies open back up, and we want to ensure that that's something that, you know, if people are needing insulin or anything of that nature, that they stock up on that beforehand. You know, doctors and pharmacies understand when a storm's coming that they will provide extra medication to folks so that they're prepared for that.
Okay. You have notification systems like Alert Escambia. Tell me about how that works to keep people informed of emergency information.
So again, at myescambia.com/beready, we have it's our Alert Escambia that you can sign up for alerts that will notify you of any potential. When we have something like an evacuation or anything like that, we notify that system, and it's really good for other smaller events that we might have as well. So. But one thing that I'd like to assure everybody is we've adopted a new policy through FEMA. It's called iPause, where when we send out an evacuation notice, it will go to your cell phone, to your TV, to the radio, and so we'll ensure that that system ensures that people get alerts. But the Everbridge, our Alert Escambia, is still a very good tool. You always want multiple ways to get information, and especially, you know, I know a lot of there's some seniors I know that don't use social media, and we utilize social media a great deal to put information out. But weather radios are another really good source of information, and so any way that you can to get alerts and to stay weather aware and to know what's going on, what's coming up, that we really try to encourage folks to do that.
What if someone is physically unable to prepare their home? What advice do you have for them?
So I'm glad that you mentioned that. Actually, in certain cases, we've actually had that come up, and we've actually referred them to Council on Aging, and we encourage people you've got to interact with people. You've got to, if no one knows that you're in a situation where you can't put the shutters up or you can't physically do something, meet your neighbors. Go to a place of worship. Make sure that you're interacting with people, that you have some people around you that can help you with that. That's so very, very important.
It is. Is there anything else you want people to know as they prepare for this season of storms?
I do. So we have I brought with us here today, it's the Escambia County, Florida Disaster Guide. We give these out for free to anyone. All you have to do is come up to 6575 North W Street, that's the public safety facility, and we give these out for free. We give presentations. We always bring these with us. This guide has everything in it you could possibly need to know about preparedness, and for not just for hurricanes, but for tornadoes, for wildfires, for anything, all hazards that would affect our area. It's valuable information, and it's free to every citizen in Escambia County.
Awesome. Thank you so much for joining us today.
Thank you.
Stay tuned. Next, we're talking to the director of OASIS Florida about their decades of work in the community to prevent the spread of HIV and AIDS.
Over 2 decades ago, TLC caregivers partnered with the Council on Aging of West Florida to assist seniors with non-medical help to stay independent in their own homes. Our commitment to providing these services started in 1989 and has grown to aid people from birth through geriatrics. From a short visit of 2 hours to 24 hours a day. We're a proud sponsor of the Council on Aging of West Florida. We're TLC caregivers.
When cancer tries to take you away from the things that matter most, Baptist Cancer Institute offers caring physicians and the most innovative treatment options. With convenient locations and a wide array of support programs and services, we're here to help you during the most difficult of times. As a member of the Mayo Clinic Care Network, we're bringing even more innovative cancer care to our community right here at home. When you need cancer care, we'll be there.
They call me Prince like I'm royalty or something. But the places I've lived ain't no palaces. So I don't need grilled salmon or a new scratching post. Just give me a cardboard box and a can of tuna and we're good. You can even change my name. I'm cool being the kitty formerly known as Prince.
OASIS Florida is a nonprofit that was established in 1991 to fill the void in support for people in the community who are positive for HIV or AIDS, particularly in the LGBTQ community. The group offers education, support, and resources for those affected by HIV and AIDS through a variety of programs. Today we have Executive Director Kurt Goodman to tell us more about the organization. Thank you for being here today.
Thank you for having me.
First off, tell me what OASIS does in the community and what all you offer.
Well, so OASIS is the what we call lead agency for the 4 counties of Northwest Florida. We cover Escambia, Santa Rosa, Okaloosa, and Walton counties for any HIV medical services or prevention services. We are what's called the lead agency for the Ryan White program. The Ryan White program is a federally funded Ryan White CARES Act that was founded, I believe, in 1990s when it came out, but it provides money for states to care for people who are living with HIV. And our primary role as an agency is to coordinate the services that people who are living with HIV need to be successful and adherent to their treatment on the one side. And then on the other side, we have the prevention where we do testing, prevention, outreach, sexual education. We provide free condoms and free barriers and testing and whatever the community needs to reduce the amount of HIV in the community, and also STDs. STDs are pretty bad right now.
What are some of our community's needs or challenges you see in older populations?
A lot of the challenges that we see in the aging population is the same challenges we see in, in pretty much every other population. I think with the exception of maybe awareness. I think that's a little bit of a bigger challenge in the aging population as far as HIV and STDs in particular. I don't think that that's really in the forefront of their mind. And the younger generation understands STDs and that sort of thing, but they may not necessarily have the information they need to be safe because, obviously in Florida it's abstinence-only education, which is a problem. But the older adults, I just don't think they're quite aware that this is something that they need to be conscious of in their sexual life. One story that I like to tell is, this woman who was married for over 40 years. Her husband passed away, and after a couple of years, she kind of dipped her toe into dating again, and she met a gentleman that she really liked spending time with, and over the course of a couple of weeks it kind of started becoming serious, and he asked her to take a trip abroad with him, which she did, knowing what that may lead to, only to discover things that were not so great. Right, and so then the next week she's in my office, and one of the first things that she said to me was that I didn't know people like me could get STDs, and I really kind of had to take a step back from that for a minute because HIV and STDs are not a promiscuous person's disease, they're not a bad person's disease or anything like that. It's the reality of being a sexually active person. So having the knowledge is critical on how to protect yourself.
And you alluded to this earlier, but where does our area stand in terms of HIV prevalence, or is there anything surprising about the current trend statistics with that or any STD?
There's, I could throw out a bunch of statistics that are pretty scary. For example, in the state of Florida, 1 in 292 white adults are living with HIV. 1 in 156 Hispanic adults are living with HIV, and 1 in 49 African American adults are living with HIV in the state of Florida. Those are pretty sobering statistics. We are in a better place now than we were. I came to work for OASIS in 2017, and we really had an HIV outbreak at that point. We had a lot of new cases at a time when most places in the country are actually dramatically reducing the amount of new infections that they have. We've come so far. This is not the 80s and 90s anymore. Medical treatment for HIV is really, really good. HIV is now a manageable chronic disease, much like diabetes. If you stay in treatment, are adherent to your treatment, you're going to be fine. You're going to live a long, active, healthy life. A 21-year-old kid today diagnosed with HIV has the same life expectancy as a 21-year-old kid without HIV. But the key is you have to stay in treatment. If you're successfully treated, which we call undetectable. So what the medication does is it reduces the amount of HIV that's in your blood to a point where it's called undetectable. When you reach that undetectable status, you can no longer transmit HIV to your sexual partners. So it's critical that we find people, get them tested. If you're sexually active, have ever been sexually active, you need to be tested for HIV and all STDs, because we can treat you and we can prevent you from spreading the disease if you have it to somebody else.
And you're of course talking about not just people in the LGBT community,
oh, absolutely
but
not.
everyone.
And that's I get a little irritated sometimes when people talk about HIV, and it's not a gay disease.
Right.
Yes, it was very prevalent in the gay community, but that does a disservice to a lot of other communities that are experiencing HIV outbreaks, because there's a lot of stigma around that just because, oh, well, it's gay people are getting it or something. It's not fair, because again, it's not a disease that goes after bad people.
Of course. Tell me about some of the direct support people can receive through OASIS.
Yeah, so if you are living with HIV in the 4 counties area of Northwest Florida, we can provide you with whatever services you need to be adherent to treatment. So it's everything from your medications, which we provide to you for free, your medical care, which is provided to you for free, housing, transportation services, mental health services, drug rehabilitation services. You name it, if you need it to stay adherent to your treatment, we can provide it. If we don't provide it in-house, we contract it out. For example, like we don't provide the medical care in-house, we contract that out with AIDS Healthcare Foundation or CAN Community Health. But really, any kind of resource that you need, we can provide for it through the Ryan White program. It's a really fantastic program. And then on the prevention side, everything that we do on the prevention side is absolutely free as well. It's not just HIV testing. We do all STD testings. You can come in, we do free HIV and STD testing for everybody that wants it. And if you need to be treated for an STD, we have very affordable programs. For example, at Can Community Health, for $35, you can go in and be treated for any STD. Same thing at AIDS Healthcare Foundation, or even at the Department of Health. We have places that we can send you. So come in, get tested, we'll get you out there and get you treated if you need it. And we can provide you with any kind of barrier you may need to keep yourself safe. This here is an at-home HIV test. A lot of people are shy about getting on one of our vans or coming into our office for testing. They don't want to have that face-to-face conversation. I prefer they come in so that we can talk to them, because if there's an issue, we can obviously get them into the services they need. But these at-home HIV test kits are available for free to anybody in the community that wants it. You can call OASIS, we can send it to you, or you can drop into one of our offices and we can hand it to you. And you can take it home, or if you have friends that you think may need to be tested, it's a good way to say, here you go, we think you need to go get tested. It's a great way to have a conversation about your sexual health. I think it's so important that it goes back to education. Knowledge is power, right? So if we can start having those conversations, if I was a parent and I had kids today, you need to be having very frank, very specific sexual health conversations with your kids, because the statistics that I'm putting out there are frightening.
Indeed, they are. How can people get involved or support the organization?
The best way that you can get involved and support OASIS is by having those conversations with your friends and your family, talking to them about their sexual health, talking to them about sexual practices. Make sure they're safe, not just safe sexually, but are they in a safe environment? Are they, a lot of times kids aren't getting that guidance. One of the highest rates of STDs we're seeing right now is in 15 to 24-year-old kids. 15-year-old kid to me is a baby, right? So it's one thing to think about them being sexually active. Obviously, that's not something we want, but we also need to have the conversation with them that if you choose to be sexually active, we can keep you safe. And that's the best support we can get.
Gotcha. Thank you so much for being here today.
My pleasure.
Until next time, enjoy life. You've earned it.
It's not.